I see your journey, and it kind of points finger at somebody who's a hero to me. Barack Obama.
Really? Well, that's the first time I've ever been compared to Barack Obama.
Cool, calm.
Yeah.
He's got the swag though.
Yeah. I'll work on that.
You work on that? Yeah, okay. But he did all that grassroots leadership.
Yeah.
Serving the people. He, again, was
he was a community organizer.
He was a community organizer.
Yeah.
Am I having a conversation with the future Prime Minister? Henry, I'm really pleased you could be here with me today.
Me too.
And thank you for taking time to come and visit our pharmacy.
My pleasure.
I did Google you, I did chat GPT on you just to see your journey. And it's been a very interesting journey. It's like you've been everywhere that any person who wants to see bigger things happen has been. So you've been in housing, public health. What else? Local authority.
Health foundation.
Fantastic. You know, I'm thinking this is the kind of person that taxpayers want to lead them. MPA? How did that happen? What?
Yeah, so I think one of the main reasons that I came to the MPA was in my previous role I was working at Asthma and Lung UK, which is it's the UK's lung health charity. It represents the 6 million people who have a lung condition at some point in their lives. And through that work, I did a lot of work with community pharmacy actually. So it was delivering asthma and COPD reviews through community pharmacy. And through that work, I got to see just the potential of what pharmacy could do in long-term condition management.
Gotcha. Yes.
So that was really interesting, and that's where my kind of interest came from.
Fantastic. Because ChatGPT actually describes you. Are you ready for this?
All right, go on. What is it? So I haven't done this before.
It describes you as the equivalent of a public health Swiss Army knife.
Okay. Good.
I think that's a massive compliment.
Yeah, no, it's a really interesting one because I've got a very varied experience. So I did a couple of stints in local government as well, and I was actually working in Newham during COVID when it had the most amount of deaths of any local authority area in the country.
Yes,
because it's the most diverse local authority area anywhere in the country. I worked on the COVID-19 app trial. So the original app was trialled in Newham, and then it was also trialled in the Isle of Wight. And that was a really fascinating project. But it was also quite a crazy time as well, because there was so much going on and the government was really pushing everyone to get on the app. But in somewhere like Newham, there was, a lot of mistrust of government, a lot of issues with vaccine hesitancy as well, a bit further down the line. So it was trying to work out how do you get people to really engage in that.
That's right, because there's more BME.
It's 72% in Newham.
Yeah. Talking about diversity, I don't think they get any more diverse than you and I are. So you were born in London.
Yes.
Uni in Oxford.
Yes, that's
politics.
Correct. Yeah.
I was born in Camden Town.
Yeah.
Raised in Lagos.
Not too far away.
Not too far away, but I was raised in Lagos. I did my uni in Lagos. Nigeria.
Yeah.
It doesn't get much further apart than that. But when I look at you, I see your journey, and it kind of points finger at somebody who's a hero to me. Barack Obama.
Really? Well, that's the first time I've ever been compared to Barack Obama.
He cool, calm.
Yeah.
He's got the swag though.
Yeah. I'll work on that.
You work on that? Yeah, okay. He's got the swag. But he did all that grassroots leadership.
Yeah.
Serving the people. He, again, was...
he was a community organizer.
He was a community organizer.
Yeah.
Am I having a conversation with the future Prime Minister?
Well, probably not, because I've worked for 3 different MPs, and I loved it. It was really interesting. I worked, in Parliament during the Iraq War, for example, for some very interesting times under the end of the last Labour government. But I actually realised that I could influence the system more from outside than inside, because in order to really influence the system, you have to get right to the top. And in order to get there, you have to compromise along the way, of course, in terms of how you get there. But I actually found that when I was working in Parliament, because one of the things I did really early in my career when I was working for an MP is we banned junk food in vending machines in schools just through a private member's bill. Wow. And that was a really interesting piece of work. And I kind of realized that actually you can do more through little interventions like that, or lobbying government from outside, than sometimes you have to do when you're in charge, because you have all of those other pressures. Whereas if you're from outside, you can take an issue, you can get a government to do something. Correct. And that was similar. So I've just come from Asthma and Lung UK, where we worked on the legislation to ban cigarettes from anyone born after 2009 forever. Yes. Which was another, but that just shows that, you, of course it was the government that did that, but actually if you can push the campaign from outside, you can sometimes get the government to do things that you want them to do.
I actually resonate with that a lot, because when I started my journey being vocal in pharmacy, because someone said to me, the only way you can get your voice out is either you win an award. I tried, I didn't win. Or join the committee of a group like the MPA. Yeah. I tried, I didn't get in. Now,
we'll get you one eventually.
The truth is, just like you say, from the outside, I don't have to worry about what the membership think about me. I can say whatever I like. When I say whatever I like, what I feel passionate about.
Well, you have more freedom.
I have more freedom to speak to people like yourself and say, this is what I think. I could disagree with you.
Yeah.
Do you see what I mean? And that
absolutely. And also the other thing is the focus, because, for example, when I was working at Asthma and Lung UK, we would be focusing just on people who had lung conditions and what they needed to do to have better lives and have better experience of the health system. If you focus purely on that, you can be really specific about the areas that you want to take forward. Obviously, if you're in charge of the whole health system and you're in government, you have to make compromises all the time. You've got different people.
You upset somebody all the time.
Which is what we're trying to see now with trying to get pharmacy to the top of the agenda, but there's so much else going on. There's always a challenge. So that's probably why I won't end up becoming a politician. Sorry to disappoint you, but
things change.
But actually, because what I realize is that you can influence the system better from outside because of that freedom and because of that focus.
No, that's right. I mean, talking about pharmacy, if you had a magic wand, and you could make one choice of what you will do to us as a community, because it's always great to have somebody from the outside looking in. Like you're not a pharmacist, but you're now working with the profession. What would that one thing be? So I mean, the one thing would be proper funding for the dispensing, but also proper funding for the services. Because one of the interesting things is that the UK could be, it already is, but it could be even more of a world leader in terms of delivering clinical services and independent prescribing outside of hospitals and GPs. We've got the potential with all pharmacists coming through as independent prescribers. Actually, the UK could be the world leader in that, and that's I know Canada have a system where they have polyclinics, but that's generally for sort of rural areas where there's only one provider. If we could get it right, and if we had the right funding, I think there's huge potential in pharmacy, and actually you could see one of the most interested, blended, integrated systems anywhere in the world. But the rate limiting factor is the funding to expand it. You know what the politicians have done right now is they've put the funding in a pot that we cannot access. So say, for example, Pharmacy First. We've not been able to use 50%, whatever, of that funding. And I fear that that's what's going to happen again, that enabling us to get value from dispensing so we can invest in the clinical areas by having more consultation rooms and things like that is we're kind of snookered. They want you want me to do more clinical services, but I'm not getting referrals. I don't have enough money from the dispensing to invest in consulting rooms. So that kind of bridge is the challenge that I think we have. What do we do?
Well, I mean, I think that's absolutely right. That's the right issue. But if you look at, so in my job, we represent the whole of the UK. And in my first 6 months, I've been out to Scotland 5 times. I've been to Wales 3 times. I've been to Northern Ireland 3 times as well. In Scotland and Wales, for example, they already have 50% independent prescribers. Or certainly Wales have got 50% now. They're aiming for 2028 to have 100%. And what they've already done, because they have a wider range of ailments, And people know that if you have a minor ailment, for example, in Scotland, you know that you come to your pharmacist. And so much more of it is walk-in, it's not through GP referral. And what that means is that actually it frees up the system so that they don't have to go through the GP. The GPs know that if it's a minor referral, it goes to a minor ailment, it goes to pharmacy, but you could potentially expand that. And so I think that works much better because it means that you're not dependent on the referral every time. And actually there's a real public understanding that you can get this kind of treatment in your local pharmacy, and people want that because they can access it much more easily.
Oh no, that sounds good. I mean, I'm a cup half full kind of person. I always try and see the positive in
An
everything.
optimist, yeah.
An optimist, because I see opportunity. I see the fact that we're going into another market. We've been doing a bit of PGDs here and there, but as IPs, there's a new market for us to expand into, and expertise to show the world, to showcase our profession. But the future at the moment is going to be built around neighborhood teams.
Yeah.
And when you say the word teams, I was meditating this morning and I said to myself, there is one I in pharmacists.
Yeah.
Is that the reason why we don't see that there is no I in teams? Because this idea of working alone, it's our own space, we don't come together.
Yeah.
So neighborhood teams, however, is going to need collaboration between local pharmacists. What can the NPA do to encourage grassroots leadership?
Well, the first thing I think is connect more of our members together, and that's what we're looking for. So my 3 priorities for next year are campaign. We've talked about some of the funding issues, making sure pharmacy gets the attention, the respect and the funding it deserves. Support, which is helping our members through that transition to services and giving them the support they need for insurance and other things. Yeah. And then thirdly is connect. And that speaks to your question, which is how can we connect up pharmacists or who are our members and want to ask each other questions. So that might be for a WhatsApp group, that might be for a masterclass, that might be for specific training on independent prescribing or delivering services. We want to bring those people together as a community so that if they have a question, they can ask each other those questions so that they can support each other in communities of practice and so they can give each other that assurance they need. Because sometimes, especially for those who own just their own pharmacy, one pharmacy, it can be quite lonely and sometimes you don't get to speak to the other people and know what's going on. So that's what we want to facilitate.
I love that. I love that word connect. Now, I think connect has been the issue in pharmacy for a long time. I had my pre-reg done in hospital pharmacy.
Yeah.
I never saw the I in pharmacy. I always saw team.
Yeah.
In hospital pharmacy, coming into community and realizing that the pharmacy 5 minutes away is surprised when I give him a phone call and say, hey, how are you doing? And thinking, don't you do that over here? But I'm now a PCN engagement lead.
Yeah.
I've been able to pull the team together, but we've still got that competition, which is healthy sometimes to a certain level. But when we're expected to work together, what would happen when you're supporting me as an NPA member and then the other couple of pharmacists are being supported by the IPA, and that causes another divide, you see? Because, for example, the NPA Futures package that I'm being a part of is a fantastic tool. Yeah. And I want everybody to be able to access it. Would the NPA be willing for such a tool to be used by all pharmacies in spite of being not in the NPA? Even if it came with a slight charge, then they would decide.
Yeah, I mean, we'd be very open to that. I mean, as we've discussed, the future for pharmacy is to expand services. I mean, that's the direction of travel. And it's the only way to make pharmacies more sustainable in the long run. So we're helping everyone through that transition. But as I've been saying on lots of platforms that I was speaking on, actually we need to work across the whole sector.
Absolutely.
And the whole of pharmacy needs to speak with one voice to get what we need. Because, if we're disagreeing with each other, or if we're coming out with messages that are even slightly different, or different numbers, or different asks of government, then we're just not going to be listened to, because people will say, well, they can't, or the government will say they can't agree amongst themselves, therefore we can ignore them. It's much better to have a single voice And then, we want to open our tools, to everyone in the sense of anyone who wants to make that transition, we want to support them. So we're looking at what, we're going to have a series of different tools to help people, to help IPs, to help people who want to move into services. We're partnering with different providers. And, some of that will be provided to members, but some will be open to the wider community as well.
I would advertise this tool to anybody. It's called, it's about change management. It's about getting your pharmacy from where it is right now to what the future looks like. So what the MPA did was pull a lot of innovative pharmacists together.
Yeah.
And over a period of about 10 meetings, pulling ideas together and then pulling some case studies that people could actually see what has worked in your environment so that you may learn from somebody and another person, pull all of that together and improve your practice. I think it's a fantastic
so if you go onto the website or if you just Google Future Pharmacy Network, you can access it, and we're adding new modules every week.
Yes, no, it's fantastic. And recently, the IPA put something out there which regards like a Dragon's Den event, which is commendable. And I'm thinking, yes, you're actually promoting innovation in our profession. And I've approached them asking if it's something that, do I need to be an IPA member to participate in? And, I'm in conversation with regards how we move that forward, because I am an MPA member, but I'm first a pharmacist.
Yeah.
The profession matters to me more than my membership.
Yeah.
I'm grateful for the benefits of my membership, but that membership divide defeats the purpose of the connection that we need to use to bring our pharmacy forward. If you were a pharmacist like me, what would you be doing to break this? Because it's one thing for us to expect our CEOs to do everything.
Yeah.
Do you see? Because the divide is not just on the top. How about us down here? What can I do?
Well, actually, so two answers. I think one of the things that we're trying to do is there's so much technology. I've seen some of it operating in your pharmacy earlier today. That actually a lot of our members have talked to us, and actually just a lot of pharmacists have talked to us and said we need some guidance on who we should not who we should use, but what do the different providers provide, what are the different solutions that are out there. There's so many different solutions. So we are looking at how we can help to provide some guidance on our website as to what's available and the different features of it. But I think actually, if you go into LPCs, you'll see that there's already people from IPA, CCA, independents, working together really, really closely for the benefit of that local area. And so it's already happening at a local level, and I think it's just our responsibility to make it happen on a national level. Because there's lots of tools out there, but I can imagine it must feel overwhelming when there's so many different and that's why I think you need the connect bit, because part of the connection is just about saying, okay, who's your PMR provider? How have you found them? Does it work with this? I've got this particular type of system. Would that work for me, or do you need to have a larger premises, or all those kind of questions? And I think when you connect people up as a community, then they learn from each other, and that benefits the whole. It overcomes that issue about competition, because also pharmacy is really interesting. That generally speaking, if your competitor shuts down, it benefits you, right? But in pharmacy, actually, it can be really difficult, because then you receive all of their patients, and suddenly you're overwhelmed. So we do need to work together. We need to be a part of an ecosystem, a part of a community, and that's what we're really trying to encourage. And we will soon have some forums for them to do that.
Oh, fantastic! On a lighter note, how many children have you got? 2. Boy, girl?
Older girl. I've got a 12-year-old girl who's going on 25, and a younger boy who's 10. Who's a bit more chilled out.
Oh, fantastic! So, say in another 6 years' time, one of them's going to be doing A levels and says, "Dad, I'd like to study pharmacy."
Yeah,
and Dad's going to say,
"I would encourage them." Yeah. Well, hopefully by then we will have secured a better funding setup.
The funding setup, I know.
But no, I mean, from what I've seen, it's a really rewarding job and really special, because you have that direct access to the public. The public can walk, and I think the public have really, really understood that, particularly during COVID. But post that, it's a NHS. I mean, how many other NHS services can you just walk in from the street and get advice straight away? And I think people really value that.
So. But is that why we're undervalued, though? Because again, we want to do things, we want to help, but maybe we've done so many things free
Yeah, I mean, I think it is. I think it's the superpower with regards to the public, because they, especially with the issues of accessing other parts of the, how long the hospital waiting lists are, the issues with getting GP appointments. I think that's the bit that the public really appreciate. But part of the issue is it can be taken for granted, because also we don't have the systems yet to capture everything that we're doing. So when we say to the government, we're playing this key role, just if someone comes in and gets a bit of advice and then goes, how have we captured that to show that the benefit? That might have prevented someone going to hospital or someone going to a GP.
Correct, yes.
But unless we can show the data, it's hard to make the case.
So we need to prove our value
Exactly.
In a scientific way. No, that's really great. Thank you so much for spending time with us today. We really appreciate that.
Yeah.
As a family, on behalf of Dupe, Dara, and Daniel, thank you very much.
My pleasure.
Thank you to Henry Gregg from all of you. It's been really nice to have him see our pharmacy today and just kind of collaborate ideas of where we think pharmacy is and where pharmacy needs to go as far as what the NPA can support us with. Thank you.
Great.
That's my first podcast ever.